This presentation looks at the effects of diet complexity, antibiotics, and benzoic acid on nursery pig growth performance. With decreasing use of antibiotics in swine diets, acidifiers are being investigated as potential alternatives. Now, Viva Vital, which is a product made by DSM, is a source of benzoic acid, which is utilized in nursery pig diets. Now, it has been used by European swine nutritionists for a number of years, but it's recently been brought to the United States. Now, the data from the European trials indicates that adding benzoic acid to nursery pig diets may improve growth performance. However, there's been little research conducted with benzoic acid in the typical U.S. diet formulations. Now, some of these typical U.S. diet formulations include corn and soybean meal-based diets, also diets with pharmacological levels of zinc oxide, as well as diets containing antibiotics. So therefore, the objective of these trials was to determine the effects of diet complexity or antibiotic inclusion in the diet on the response to benzoic acid on nursery pig growth performance. Now, these are the materials and methods used for both experiment 1 and 2. Now, there were two 28-day trials, and in experiment 1, 280 pigs were used. These pigs averaged initially 7.0 kilograms, and there were 7 pigs per pen. Now, in experiment 2, there were 240 pigs used, which were initially 7.3 kilograms, with 6 pigs per pen. Now, in both experiments, there were 10 pens per treatment, and pigs were weaned at 21 days of age. They were fed a common pelleted diet for 3 days, and then on day 3 after weaning, was when the pigs started on the treatment diets, and so this was considered day 0 of the experiment. Each trial was conducted using a 2-phase diet series. Now, pigs and feeders were weighed weekly to calculate average daily gain, average daily feed intake, and feed efficiency. Pens contained dry feeder, nipple water, and they were provided ad libitum access to feed and water. For the statistical analysis, the growth data was analyzed using the PROC mix procedure in SAS. Each experiment was arranged as a 2x2 factorial treatment structure. Pen was the experimental unit for all data analysis, and after analysis, there were no dietary interactions at p is greater than 0.33. Now, looking specifically at experiment 1, there were 4 treatments. Again, they were arranged as a 2x2 factorial treatment structure. Now, the first main effect was diet complexity, and pigs were either fed a simple or a complex diet, and diet complexity only applied to day 0, from day 0 to 14, so the first phase. Now, the second main effect was with or without benzoic acid. This was at 0 or 0.5%, and this was maintained throughout the entire trial from day 0 to 28. Now, all diets were fed in meal form and were prepared at the K-State Animal Sciences feed mill. Now, I'll start the slide over. All right, taking a look at our diets for experiment 1, the 2 diets for phase 1 are shown on the left. And again, this is from day 0 to 14. The pigs were fed either simple or complex diets. The simple diets were simply corn and soybean meal-based diets with synthetic amino acids. Now, the complex diets were corn and soybean meal-based with 10% spray-dried whey, 1.25% select menhaden fish meal, 1.25% spray-dried blood cells, and also 0.25% added zinc oxide. Now, looking at phase 2, again, this is just with or without benzoic acid, but it's a simple corn and soybean meal-based diet with synthetic amino acids. Moving on to the calculated analysis. For phase 1, both the simple and complex diets were formulated to similar amino acid ratios. Specifically, they were formulated to 1.3% SID lysine. And then moving on to phase 3, phase 2, the lysine level was reduced down to 1.26%. Now, looking at the growth data, we're going to specifically start on day 0 to 14. Here again, this was when the different diet complexities were fed, as well as different levels of benzoic acid. We're going to start on average daily gain, which is on the y-axis. And looking at the x-axis, the pigs were fed again either simple or complex diets, and the pigs fed diets without benzoic acid are shown in purple, and the pigs fed diets with benzoic acid at 0.5% are shown in blue. Now, as you can see, there was no difference when benzoic acid was included in the diet. However, in terms of average daily gain, pigs fed the complex diets had greater average daily gain than those fed the simple diets. When looking at average daily feed intake from day 0 to 14, again, there was no difference when benzoic acid was added to the diet. And similar to average daily gain, pigs fed the complex diets did have greater average daily feed intake than those fed the simple diets. When looking at gain to feed from day 0 to 14, there was no difference when pigs were fed with or without benzoic acid. However, again, with diet complexity, those pigs that were fed the complex diets did have greater gain to feed than those fed the simple diets. Now moving on to phase 2 of this trial, which was day 14 to 28. First, we'll look at average daily gain. Now remember that on the bottom of the slide indicates simple versus complex diets. However, keep in mind that these simple and complex diets were this is the treatments that were previously fed from day 0 to 14. Remember here during this time in the diets, they were either fed the common phase 2 diet, either with or without benzoic acid. So here we do not see a difference between 0% or 0.5% benzoic acid. So again, adding benzoic acid into the feed did not influence average daily gain during the second phase of this trial. However, there was a trend for pigs fed the complex diets during the previous phase to have a lower average daily gain than those previously fed the simple diets. So this is some indication of maybe a little bit of compensatory gain happening due to their slower performance from day 0 to 14. So there was a tendency here in from day 0 to 14 for average daily feed intake. With pigs fed benzoic acid, they tended to have higher or increased average daily feed intake compared to those fed diets without benzoic acid. In terms of diet complexity, there were no differences on average daily feed intake. Now looking at gain to feed, there was no difference in feed efficiency with or without benzoic acid in the diet. However, pigs that were previously fed the simple diets did have improved or increased gain to feed during the second phase. So again, this is a slight compensatory response. Moving on to the overall data from day 0 to 28, there was no difference of the main effect of benzoic acid. However, similar to the first phase of the trial, pigs fed the complex diets did have improved average daily gain for the overall trial. Again, average daily feed intake follows the same response where benzoic acid was not significant. However, pigs fed the complex diets did have increased average daily feed intake from day 0 to 28. And then again, for overall feed efficiency, there were no differences with benzoic acid or with diet complexity for the overall trial. So in summary of experiment 1, Feeding the simple corn and soybean meal-based diets reduced growth performance from day 0 to 14 compared to the pigs fed the complex diets. Now, there was some compensatory growth that occurred during phase 2, but it was not adequate to compensate for the poor average daily gain and average daily feed intake that we saw in phase 1. Also, in this trial, there were no improvements in growth performance when benzoic acid was included in the diet, regardless of the diet complexity. So looking at the dietary treatments in experiment 2, there were 4 treatments arranged as a 2x2 factorial structure. Now, the first main effect was with or without antibiotics. In this case, we used Carbadox as the antibiotic. And the other main effect was identical to the previous trial, which was with or without benzoic acid. Now, the same levels were used for benzoic acid in this trial as we did in the last, with either 0 or 0.5% benzoic acid. And for Carbadox, from day 0 to 14, it was either included at 0 or 55 parts per million, and from 14 to 28 was either included at 0 or 27.5 parts per million. In terms of the diets for experiment 2, we used corn and soybean meal-based diets. Again, we decided to use the complex diets from the previous experiment because there was no difference in terms of response to benzoic acid with diet complexity. We decided to go with the complex diets because these are the most representative of what's being used in the U.S. Now moving to the growth data, I'm going to focus on the overall data for this trial. I'm not going to split it up by phase, and really the main reason for this is because the response within each phase was identical to the overall data. There were no differences in the overall data when looking at it by phase. So we'll focus on day 0 to 28. In terms of average daily gain, benzoic acid did not significantly influence average daily gain for the overall trial. However, including an antibiotic in the diet, again, Carbadox, did improve average daily gain. When looking at average daily feed intake, we see a very similar response to that of gain, in which benzoic acid did not significantly influence the average daily feed intake of these pigs. However, pigs that were fed antibiotics did have improved average daily feed intake. And finally, moving on to feed efficiency, for the overall trial, day 0 to 28, there were no differences when adding benzoic acid in the diet or adding an antibiotic. So, in conclusion of this trial, the inclusion of dietary antibiotics did improve growth performance of nursery pigs. However, there were no differences observed in average daily gain, average daily feed intake, or feed efficiency when benzoic acid was included in the diet. So for the overall conclusions of these 2 trials, pigs fed complex diets or antibiotics did have improved growth performance. Now this data that we had showed that it was contrary to some of the previous European data, where we found no differences from including dietary benzoic acid in either experiment. Now I want to thank you for your time. Thanks the whole research team here at Kansas State University, as well as DSM Nutritional Products, for partial funding of this trial.